My name is Šekib Sokolović. I'm professor of internal medicine and rheumatology, and I'm also cardiologist, So I'm coming from Sarajevo, Bosnia and Herzegovina, and I work in University Clinical Center and Medical Faculty of Sarajevo as deputy head of cardiology clinic and rheumatology. I came here for the conference. I was invited for the conference to provide a workshop on capillaroscopy. It's hands-on training. So I had 2 sessions, morning and afternoon session, providing to the delegates who signed to learn about capillaroscopy. Capillaroscopy is a diagnostic tool, machine, non-invasive, that you look at the capillaries. These capillaries, they are microcapillary vault is the first pathological site of many, many diseases. So we use this capillaroscopy diagnostic tool in many diseases, like distinguishing primary Raynaud from secondary Raynaud. Raynaud phenomena is when somebody, especially young girls, they have blue hands, exposing them to the cold, to the stress. So but this can be also the secondary to the secondary systemic sclerosis disease, like scleroderma, in the pulmonary hypertension, in dermatomyositis. We use this tool, diagnostic tool, in polymyositis, systemic lupus erythematosus, antiphospholipid syndrome, and we can also predict digital ulcers as the final consequence of disease. But also we can use in cardiology, in arterial hypertension, in diabetes, in atherosclerosis, and we can also link the changes in capillaries linked to the coronary slow flow phenomena. So if you find some small changes in the capillary loop with the patient without any heart symptoms, we can detect some pathological change in the coronaries. For what is the important for the patients for this diagnostic tool is because it provides a real picture of the endothelial function and the capillary function in the hands and feet, in the whole body, and we can use it for diagnosis. For example, if the patient has Raynaud, if it has capillary, some pathological changes, and if it has on autoimmunity test positive, ANA positive, we can predict this patient will develop in the near future, in the next 2 years, systemic sclerosis or scleroderma. So we can also use this for therapy monitoring. So if we follow up the patients after 3 months, and then we can detect some minor changes. So we can say, well, our therapy works, our therapy doesn't work, so we have to change it. So this is patient can be asymptomatic, but the pathological changes can occur and can develop more in the capillary vault. So this is a very important diagnostic test that we can use for our patients.
So in summary, psoriatic arthritis is a heterogeneous disease with a lot of challenges, both for diagnosis, assessment and treatment, but we have seen a lot of progress the last years, which will benefit the patients both for diagnosis, assessment and treatment. Thank you very much for your attention.